Hi, guys. Welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review books, review videos, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, I always like to go over my disclaimer and reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis. So, any of the questions that you see here, I have designed and created based on what is currently being tested on the ANCC as well as AAMP exam. Now, any of my videos that you see where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states the nurse practitioner and NP student are discussing short acting beta agonists, also known as SABAs. All the following are SABAs except is it A, albuterol, B, Zopinex, C, salmeterol, or D, levoalbuterol? Take a moment and tell me what you got in the comments, you guys. I always recommend reading the stem of the question first to ensure you're answering what is being asked. So here the stem of the question states, all of the following are SABAs except. Now look, here the stem of the question is all you really need to know for this question, right? See the importance of reading the stem to gauge what they're really assessing and asking you, okay? So all of the following are SABAs except. Is A, albuterol SABA? Yes, it is. B, Zopinex is also a SABA. C, salmeterol. This is the incorrect one. C is the best answer here because salmeterol is not a SABA, it's a LABA, right? And then D, levoalbuterol is also a SABA. It's the same thing as Zopinex, the alternate name, okay? Make sure you know your medicines, know the brand and generic name, and know the drug classes. All right, question number two. The nurse practitioner and NP student are discussing long acting beta agonists, also known as LABAs. All of the following are LABAs except is it A, salmeterol, B, formoterol, C, cerebant, or D, Spiriva? Take a moment and tell me what you got in the comments. Stem of the question here. All of the following are LABAs except. So we're looking for the incorrect again, right? So A, salmeterol. Yes, that's a LABA. B, formoterol is also a LABA. C, Ceravent is also a LABA. D is your best answer. Spiriva is not a LABA, is it? Spiriva is in the class of your muscarinic agents. All right, and then lastly, question number three. The nurse practitioner and NP student are discussing precautions of SABA use. All of the following are precautions of SABA use, except is it A, arrhythmias, B, diabetes, C, epilepsy, or D, gout? Take a moment and tell me what you got in the comments, you guys. Stem of the question, all of the following are precautions for SABAs, except. All right, so also when knowing the medications, knowing the drug classes, knowing generic and brand name, the big reason that you want to know those medicines in a drug class, because if you can group them by endings or like identifiers by the name or the spelling of words to put them into a group, you're able to associate all of the things that are contraindications, precautions, etc., with those medications. So with SABAs, precautions are is arrhythmia precaution of it? Yes, it is. B, diabetes is also a precaution. C, epilepsy is also a precaution for SABA use. D, gout is the incorrect answer. So that is the best answer choice here because we're looking for the incorrect as it asks for all the following except, right? So D, gout. There's no precautions with gout and SABA use. Now think about it. With SABAs, those beta 2 adrenergic agonists, you have things because they can affect the pulse rate, right? So arrhythmias because it can alter your heart rate. Also, it can also affect the glucose reading. So diabetes, you want to be careful and cautious with utilizing that. And it also can cause tremors and some events trigger an epileptic convulsion. So you want to be precautious with prescribing SABAs with those with a diagnosis of epilepsy also. So make sure you know those precautions and contraindications for common medications that we're prescribing, okay? All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But make sure to meet me back here. And if you need any of the resources I offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one at gmail.com. Things that I do offer are the review book. It is either in the ebook fashion or the paperback option. They're both linked in the bio of this channel. If you enjoy, or I shouldn't say enjoy, because I know studying isn't anything that we desire to do on a regular basis, but if you prefer independent studying, I have a self-paced review for family and adult Gero that has videos per system. It's designed for both exams. There's a non-clinical section that is also linked in the bio of this channel. My 5-week group intensive review, the next one is in September, so you will see the link next week for that to start enrolling if that is what you're looking to do. And then lastly, the one-on-one sessions. You know, with one-on-one sessions, I always say, be sure to reach out because it is customized. So we want to make sure that you are choosing the right one for you. The options are you can utilize and book a session for weaknesses, covering 1 to 2 per session. You can book an exam readiness assessment, or you can book the custom package where you are provided a pretest to gauge where you currently are. And based off of the time that you're looking to allot to prepare for boards, I structure a study plan with you, work alongside with you during that time frame to take you to a successful exam. All right. But as always, make sure y'all meet me back here. Happy studying. Bye, y'all.